My name is Karen Gilbert, and just a brief introduction to myself. I worked as an internal or in-house clinical trainer for Barnett, and I've been in this position since June of this year, and I'm absolutely loving it. As you've experienced with Barbara Potter, the Barnett team is just fabulous, and I really am very pleased to be working with them. Prior to joining Barnett, I've worked in the clinical research industry for about 14 years. I started in 1995, but I've worked in medical devices and pharmaceuticals. I've worked as a monitor, as a CRA, as well as a site director for 5 years. I managed a multi-specialty site. And I've also worked as an internal CRA trainer and a global study lead. And I think it's the position as a CRA and as a global study lead that impart my ability, if you will, or understanding of the monitoring plan development. As the global study lead, I was responsible for developing and maintaining our monitoring plans for our studies. And then, of course, as a CRA, I was responsible for implementing those. So that's just a little bit about me, okay? Let's look at our next slide. And this is sort of the reason that we feel like this content is so important, because as you know, in clinical research, it's really important that we're aware of these two objectives. It's not only a compliance objective. You know, we certainly need the ability to see if we're following policies, including the monitoring plans. But it's also really important to understand if the policy itself is effectively working for our organization. So we really hope that by applying the information that we're going to share over the next couple of hours, it will allow your organization to satisfy both of these goals. So this is sort of the design of what we'll cover today. It also reflects our learning objectives. We want you to be able to understand the design of a traditional clinical trial monitoring plan. You'll see the acronym MP throughout the slide for monitoring plan. And we're going to review in some detail what the traditional monitoring plan looks like, okay? But I won't spend too much time since you guys are so familiar with them. But then we want to move to talking about how do you actually develop a monitoring plan that meets the unique needs of an individual project or study, because it's really important that it be customized to individual clinical trials. We're going to challenge you to think a little bit more futuristically, if you will, or outside the box about can we develop monitoring plans to meet the unique needs of sites. And then throughout the presentation, we're going to spend some time talking about how a monitoring plan can actually be a part of your performance management system and how it can help you to not only meet current project goals but promote continuing improvement from study to study. And you may be familiar, I'm sure most of you are familiar, with the new draft guideline that was issued actually not so new, a couple of months ago, August 24th, the risk-based monitoring guideline, the draft guideline for risk-based monitoring. We are not going to spend, we're going to touch on that in the next couple of hours, but not going to spend a tremendous amount of time on that. We do have a separate webinar. If you really want to dig into the specifics of that guideline, we do have a separate webinar at Barnett. It's called Implications of the Guideline for Risk-Based Monitoring. So I encourage you to maybe sign up for that course if you really want to get into the nuts and bolts. But we are going to spend a little time on it today because it's so critical to understanding what the FDA expects of our monitoring plans moving forward in the industry.